Amanda, we just heard from Governor Lamont a short time ago. He spent a lot of time talking about hospitalizations. He says the state has averaged about 90 hospitalizations over the past 5 days or so. And last week, that number was about 102. He says the decrease in numbers show the curve seems to be flattening out, giving hospitals more time to plan ahead and handle patients coming in and out without more stress. And while talking about testing, Bristol Health announced they are now limiting tests to 40 a day due to a decrease in supply. And here's what the governor had to say when we asked about the supply of tests here in the state.
Hi, Governor. Bristol Health came out saying today, due to the decreasing supply and limited availability of testing kits, they're only doing 40 tests a day because they simply just don't have enough tests. Is Connecticut getting more tests, and if so, when?
I can tell you our testing has been generally ramping up over the last week or so. I can tell you we have a couple of new companies that will be greatly increasing our capacity there. If Bristol Health is having a problem with reagents and the such, there's been stop and starts on a couple of the local hospitals. We're trying to keep that flow going. Our priorities are very clear. Number one, in terms of folks who are admitted into the hospital, so we can do some preliminary triage. Who has COVID? Who has to go to the ICU? Who can we, send to intermediate care or another facility? By doing that, we're opening up dozens of beds, because we get people properly allocated. Number two, we're looking at first responders, in particular, in this case, the healthcare workers, those that are taking care of the sick, make sure they're tested and make sure that they're safe and not infecting anybody else. And finally, we are broadly testing anybody who has that special permission from a doctor that absolutely needs it. Once we get going with the CVS testing protocol, that will be broader. There's a CVS.com site. You'll be able to go to there and see what that you'll remotely put in all your different test cases, and they'll determine electronically, give you a tag whether you can get that test or not. That's probably a week or two away.
Just a few days ago, CVS launched a testing center in Rhode Island, where they can test almost 2,000 people a day. And we're going to continue to keep you updated on the state's latest response efforts to COVID-19 coming up tonight at 10 and 11. But for now, live in Hartford, Zinnia Maldonado, Fox 61 News.